I'll touch on this a number of times. I like to read. I like to watch YouTube videos about different things.
Yep.
I like to read about all the, something comes up, I'm like, oh, that's interesting. And then I read about it and I get to learn a lot about very specific things. What that's created in my life is a lot of nebulous dots that I can draw on when I have a problem.
Yes.
And I think that that's probably comes from medicine when you want to understand these little things. But I think that has been my tact. I don't know.
Welcome to Leadership Rediscovered. I'm your host, Laura Siebold, and today I am so thrilled to be talking to Dr. Tom McClellan. Dr. McClellan is a plastic surgeon and entrepreneur, having brought multiple products to the market. R&D is his passion, and he has published or received over 80 peer-reviewed articles, chapters, and issued patents. He is the current founder and CEO of InterMed Labs, which is a venture startup studio in Morgantown, West Virginia, which focuses on med tech development. He's also given me the shortest bio of anyone I've ever had on the show, and he is one of the most successful people I've gotten to talk to. So I'm thrilled to have you here today, Dr. McClellan.
Thank you so much.
I guess I should add tennis coach too
and
to your bio.
Yes.
Tennis coach. So your story is so fascinating to me, and I would love to maybe just start there, if you don't mind, just talking people through your career journey, your life journey, to get people up to speed on who you are and what you've done, because you are very impressive.
Thank you so much. Thanks for having me, number one. So I'm originally from Charleston, West Virginia.
Okay.
My father was a surgeon, and I grew up around medicine.
Mm-hmm.
I knew from an early age that I wanted to do medicine. I don't think my grades were quite followed that, but my interest was always there. So I grew up in Charleston, and then I ended up going to University of Charleston for college after many failures in other places, but I ended up doing very well at UC, and then I went to med school here at WVU. And I ended up doing general surgery here at WVU. And then I trained in plastic surgery in Boston at a place called Leahy Clinic. And then I did hand microsurgery at Duke University in Durham.
Oh, wow.
And then I did facial aesthetics, facial reconstruction at Emory University. And so after all that, I was like, oh, where do I want to go? And I really thought my destiny lied in academics. I published a lot of papers. I was very interested in research. I loved teaching. I loved being around the students. But during my training, I had got the innovation bug, which I'm sure we'll talk about.
Yeah, definitely.
And when I started looking at my career, family is really important to me. When you're in academics, if you're not moving every 5 years or so to move up the chain, you get stagnated in one place. That's not everybody's journey, but for people that go into academics that want to be chairs, that's a typical journey.
Gotcha.
I didn't really want to do that. I wanted to have a more stable kind of home life and have my kids be in one area.
Yeah.
And so we were looking around. My wife's parents had moved back to Morgantown. They were originally from Morgantown, lived away, and then moved back here. And so there was an old plastic surgeon here, and his name was Dave Fogarty.
Oh, yeah.
And he reached out and said, hey, this is a really nice place to practice. He had since retired. And I looked around and I looked at I'm a nerd, so I looked at demographics and crunched everything. And I was like, oh, this seems like a good place to be. A big attractive part of it was I wanted to do everything. Mm-hmm. So I trained in many facets of plastic surgery, from very, very complex to, the very simple.
Right.
And if you go to a larger city, in private practice, that is, you quickly get narrowed down into, the hand person or the face person or the Mohs reconstruction. And I liked it all. And so I wanted to be in private practice. I wanted to start my own business. I wanted to do everything in plastic surgery. Mm-hmm. And most importantly was I wanted to own my own ideas. And when you go to academics, you sign your ideas over to whoever employs you. And I knew that I had ideas that I wanted to develop.
Yeah.
And so it really led to my career choice. And we can talk about the trials and tribulations of being in Morgantown as a young plastic surgeon, but it's turned out to be just the best decision of my whole life. And I absolutely love West Virginia. I love it here. It wasn't always like that, but I found like I really found my place.
Yeah.
There's a funny song that I relate to InterMed Labs, which we'll talk about later, I'm sure. But I can't remember who sang it, but there's a little girl dressed up as a bumblebee. It's from the 90s.
Yes, is it Blind Melon?
Blind Melon. Yeah, and she's going around town trying to fit in. And I use this story about InterMed Labs being a startup studio, and I kind of feel this way about practice as well.
Yeah.
But she finally opens the gates, and there's all these other little bumblebees dancing, and that's been Morgantown for me. I found a bunch of friends, kindred spirits. You would not believe the number of innovators here that are hidden.
Yeah.
There's just so much potential. That's why I really like being here now. So
there is a lot.
That's kind of it in a nutshell. I've been in private practice 15 years. I have just over 12,000 patients.
Oh my goodness.
Yeah, a lot.
Wow.
And, it's been great. I've really, really enjoyed it.
Yeah. When did I do want to go into InterMed, because I knew of you as from your plastic surgery practice. And so then I started hearing about, I think David Goldberg was the one that told me about InterMed and everything. And you, it sounds like innovation was something that was always part of your journey, but maybe medicine was first for you and then that came in, or how did that, where did those intersect for you?
I think medicine enabled innovation. So like my innovations aren't like golf clubs and consumer products.
Yes.
My innovations are related to improving patient care. And in medicine, you run into problems. Like you'll say, I wish we had this, or I wish this water bottle were more cylindrical or wider, or it had little grippy things on the side. You run into problems that affects patient care every day. And so I would run into those problems and start to dream about ways to overcome those problems. And so right when I moved to Morgantown, I came up with a device to improve sternal closure. As a plastic surgeon, I'm responsible for repairing sternums or the chest after open heart surgery when it goes sideways. And there's people with their sternum open, and you can see the heartbeat in the ICU, et cetera. It's the morbidity associated with that is very high. The mortality is nearly 50%. So if this happens to you, there's a large chance you're going to die.
Wow.
So after fixing a lot of these, I'm like, why are we doing it this way? We're using simple wire cerclage, or a wire and it's twisted like baling wire, which is a very rudimentary way to do it, but that's still the gold standard. And so I started to dream up a way to do that. I didn't know where to go. Where do you go in Morgantown? Right. I'm on an island here, and through a friend of a friend, I got to San Francisco. I started a company, and then when I'm literally in 2008, 2009, right when I'm starting, I'm flying to San Francisco twice a month, building engineering teams. I would fly out on a Friday and fly back on a Sunday, twice a month.
Oh my gosh!
And it was very, very difficult. And it ran for about 8 years. We venture funded $4 million. It was a big deal. It's FDA cleared. It was in multiple patients, good clinical trials.
Wow!
But it failed miserably, and the experience was really rough. This will be a constant thread throughout my story. I've failed a ton, but failure's tough, and honestly, one of the saddest things, we didn't run regionals in tennis. We didn't qualify for states.
Oh.
Honestly, I took that so hard. That I had to like pump myself up and go, Tom, it's okay. They're just high school kids. Nobody died. You didn't lose $1 million. I actually took that harder because these kids who are not athletes, I'm sorry to get off on this tangent, but the feeling is the same.
Yes.
No matter what you fail at, the feeling is very hard.
Yeah.
And the question is what are you going to do about it? And so, that's pretty much a constant story. About a couple of years into that venture, I do a lot of breast reconstruction for breast cancer, and I had an idea to improve the tissue expander, which is a balloon that they put under the skin to reconstruct the breast. Fluid is a problem. Infection is a problem. Blood is a problem.
Sounds painful too. I know some people that have had that.
There are ways to mitigate that, but it's surgery.
Yeah.
But there were a lot of problems.
Yeah.
And so I came up with a very simple solution. I was very excited about that solution. I built a prototype of it, and I met at a national meeting with the very big companies that are involved in it, and they all said no. So failure, I put the idea back in a drawer, and I'm like, well, I guess this isn't the solution. Maybe I was wrong. And about 6 months later, I'm like, F those guys. I'm gonna keep trying.
Yeah.
And so one of the things I guess to touch on leadership is to reach out to people.
Yes.
To expose yourself is really, really important, because if you don't ask, the answer is always no.
Yes.
And so I cold called a guy named Jan Varner, who's a very nice guy in Missoula, Montana. His company, SSP, built specialized tissue expanders for children who had craniofacial abnormalities, etc. But they had a specific FDA license that they could build a tissue expander, and it could go right into people based on as long as they built it according to their specs.
Yeah.
So it allowed us to build prototypes that we could try on people. And I just cold called him. And I said, Mr. Varner, my name's Tom McClellan. I'm some, bald fat man from Morgantown, and I have a good idea, and I think it's a good idea.
Yeah.
And I told him about it on the phone, and he said, that's the best idea I've ever heard for tissue expander. So we worked together for a year. We built it. We tried it. It worked exceedingly well. And a year later, his company was bought for this tissue expander. And so now we're in about 25,000 women a year. There's 150,000 breast recon, so it's a large percentage of people.
Oh my gosh. This is the device that you put in the drawer.
This is the device I put in the drawer that people told me no.
Uh-huh.
And I think that, obviously life is a learning process.
Right.
That really solidified to me that you just don't give up and you keep trying. And, so that's a common thread throughout my life, through failure.
Right.
And I would encourage people out there that have ideas, or you lose the regionals or what have you, you don't make it to states, that successful people pick up and carry on.
Yes.
And so keep swinging.
Yeah.
As Jed Jericho, your last guy, would say.
Yeah, exactly. But I'm curious though, because I just think about your training in medicine and what failure is in medicine versus what failure is in business, and risk as well. I mean, when you're trying to push the edge with innovative ideas, a lot of times that feels like risk probably to people on the receiving end of it. I mean, how open is the medical community to innovation?
It varies by specialty. I would say that maybe heart surgeons are not as open to innovation as plastic surgeons and orthopedic surgeons. I think a lot of it depends on what is the device, how similar is it to what they already use.
Yeah.
What is the risk to the patient? From a surgery perspective, I'm totally risk averse. But if I see something that I'm like, I think that could improve patient care, I'm more willing to try it, because I think a physician can deduce very easily or quickly, because good ideas are based in common sense and simplicity. And if you show that to a physician that is an early adopter, I think it's reasonable. I think from a surgery perspective, no new device or anything, I'm risk averse.
Yes.
The overarching thing is do no harm. You don't want to hurt people.
Yeah.
I think on the innovation standpoint, prior to getting into humans, of course,
right, and
you're building and breaking things, and you're trying to push the envelope further.
Yes.
You must take risk or you won't make it.
Right.
And so maybe I never thought about this. Maybe my risk aversion in actual surgery, my outlet for risk is innovation.
Yeah.
Maybe that's
it's just like an interesting, I just don't think those two probably play in the same field that often.
They don't.
Which I think is so fascinating about you and your story. Yeah. When did InterMed Labs officially start?
We started in 2020, like December of 2020 is when we started.
Okay.
So the idea for InterMed Labs came from my failures and my frustrations. the frustration is if you look at books, my favorite book on startups is Art of the Start by Guy Kawasaki. I highly recommend it. But you come up with your idea. It's very linear. You come up with your idea, you protect your idea, then you go build a team, and then your team builds a product. There's a huge problem with that in medicine. The problem is how do you find your team in Morgantown, West Virginia? How do you find engineers? And just like doctors, there's good doctors and bad doctors.
Yes.
Okay? There's good engineers and bad engineers.
Sure.
And it's very difficult for someone that doesn't know engineering to find good engineers.
Right. How do you know if that's not your background?
How do you find good business people? How can you associate yourself with good money? There's a lot of money in the world for startups. There's bad money, and then there's money that can actually help you. How do you associate with good money? The problems with starting an idea is basically based on all my failures: bad money, bad team, bad regulatory, failings of my own, bad leadership.
Yeah.
And so as ideas, I continued to have ideas. I think innovation, at least medical device innovation, is Steve Blank, who's a professor at UC Berkeley, said innovation's like a virus. And it has to run its course through you. And once you get the virus, you just can't get rid of it. And I think that, very succinctly says what innovation is to me. And so once I had a little bit of success with innovation, it really started to flow out the ideas to the point where you have to be very honest with what's a good idea and what's not. And what that led to was there's a dearth of engineers here, or business people, or help, and things like that. So I started a little lab behind Walgreens in a little dingy place in the basement, a month, $500 a month. And I remember going to my wife and said, I'm going to get together with this guy, Justin, who's one of our co-founders, and we're going to start a little lab, and it's going to be $500 a month, and I'm going to commit for 6 months, $3,000. And, I got to run everything by the boss. And, and she said, what are we doing? What is this? And,
I bet.
And I said, I literally said, I was like, I don't know. But what I know is that when I get together with people in a room that are smart and driven like me, that's where the magic happens.
Yeah.
And so we started that little lab, and people just started getting interested in what we're doing, and physicians from WVU were coming over. I had physicians from Mon Health going, what are you guys doing down there?
Yeah.
And we were only building our own ideas.
It's like a little Willy Wonka chocolate factory situation.
That's what it's a very small, damp place. And the funny thing is it's owned by I won't mention who it's owned by, but a friend of mine owns it. And it was kind of derelict. There were like some homeless people outside. The locks didn't work, and there were water leaks. And so
sounds like the perfect place for a medical lab.
It was, yeah. It actually was. And so we moved in there, and we started changing the lights and converting to LED and fixing water leaks. And I'm like, guys, why are you doing all this stuff? And they're like, we're just moving in.
Yeah.
And so that was kind of the origin. And what I found was, over time, I started to see what we were doing. We were putting together a very unique team of highly trained individuals who shared kind of the innovation bug. We had no money. We had no plan. We were just in a room creating things. And so
cool.
It started to grow. And so I continually iterate on ideas. And so I started in March of 20, maybe. It was right before the pandemic, because maybe like February of 20. I sat down and wrote a white paper. So the white paper was, what are the problems with innovation in Middle America? Flyover country, so if you exclude the East and West Coast, flyover country, including Morgantown, has some incredibly trained surgeons and nurses and techs. Ivy League trained, leaders in their fields, and I know they have ideas. No one is servicing those ideas. There are no teams. And I didn't even know what a startup studio was. I had never heard of it. And what I said was kind of like the theory of the white paper was, if we can assemble a team of people that are like-minded in innovation, that have specific skills, and we narrow down what we're going to go after to certain types of devices, class 1 and 510K type devices, we keep it simple, we stay highly focused, we stay disciplined in a fail early kind of mantra.
Yeah.
Fail early, fail fast. And we take in a whole bunch of ideas, we can increase our odds of exits if we stay disciplined.
Yes.
And so I wrote all this up, and then one of my things that I think is important for leadership, I guess, is criticism. A true leader listens to criticism, listens to other people's advice, and then makes a decision. If you're surrounded by sycophants and people that are, have alternative motives, or I don't think it benefits you.
No.
You need smart, creative people that you can trust. You need to hear their criticisms, and then you need to alter your course. I think it was very important. So I actually I went on a fishing trip with some friends, and they're all wildly successful. And I took out this little white paper, and I was like, I want you guys to read this white paper and tell me what you think. These are just friends. This is how it started.
Yeah.
And, my thing is that I love West Virginia, and I want to make things better here from a perspective of hiring young people.
Yeah.
We have the talent that's at WVU is incredible.
It is. Yes.
And these kids are motivated. They're hard workers.
Yes.
They're extremely smart. And so
we want them to stay.
So that was part of the proposition of InterMed Labs is we can help these kids like have a place where engineers want to go.
Yes.
Where in the Mountain State are people building ideas for medical devices and interacting with world-class companies?
That's amazing.
Nowhere.
Yeah.
So I handed the white paper to my friends, and they didn't laugh me out of the room, and they said, we really like the sound of this. And so I got back from vacation. It was in the midst of the pandemic, like right at the beginning. And so I'd kind of put a structure around this of what it would look like.
Yeah.
Justin and Ashok and Drew Litton. And I called David Goldberg on a Saturday morning. I had always thought that like WVU, like a big academic center, would be a natural place because they have so many doctors, et cetera.
Right.
But I went back to a guy named Tom Fogarty, who's probably the most famous medical inventor of all time. He has the Fogarty Institute, which is a kind of a device kind of place where they start companies in Silicon Valley. And I started thinking about that, and I got on their website and I was looking around, and it struck me. I was like, they're not associated with Stanford. I mean, they're literally right down the street. They're associated with El Camino Hospital.
Huh.
And that struck a chord with me. And I said, maybe we're trying to attract the wrong client.
Yeah.
Maybe. Let me back up 1 second here. Why do we need a health system? Well, to build things, you have to have money.
Yes.
The problem is when you're talking about spending $5 or $10,000, for example, my wife, I can only do that a couple times, and then I'm going to get in trouble, and then I'm going to get we're not. Because if I go to my wife and I said I need $10,000, and I'm going to put it in an idea, and you're never going to see that money again, and the device success is 1 in 100. Right. How many times am I going to get to do that?
Yeah.
You can't build value without spending a little bit of money to build some prototypes, to put some designs around things, to do FEA analysis, to see how things are going to work.
Yeah, you have to invest in that.
You have to invest. So where do you get the money? So when a doctor has an idea, they have an idea. Let's say they do some research. Okay, I like the market. I like the design. It's patentable. Okay. And then according to the books, they go, okay, raise money and start a company.
Right. But a doctor's not trained to do that.
Doctor's not trained to do that. They have no idea how to do it. They don't know how to evaluate talent.
Yeah.
Doctors are cheap. They're not going to spend their own money. And they've not been down the path. Okay. So what happens is you have a tremendous amount of bottled up ideas.
Yes.
That go nowhere because it's a population of risk averse people that don't want to seem fallible, that may or may not want to spend money on their idea and may not have access to the talent to actually do it.
Right.
And so that's the problem that I saw.
Yeah.
So that goes back to the health system. Well, if a health system will believe in their own physicians, there's a whole lot of reasons why this is beneficial to a health system. It really helps with recruiting and retention. When physicians hear about InterMed Labs and what we can do.
Yeah, it's something unique.
It's very unique, and they get to own a big part of what they do. It's not like at a university where they get like 2% or something.
Yes.
They get a large portion of the equity on the initial cap table. It's very attracting to surgeons, and they either want to come here or they don't want to leave. And I think that's very powerful.
Yeah.
So after I was looking at Dr. Fogarty's place at El Camino, I've always been the person to just cold call.
I love that.
And it was a Saturday morning, and I was like, yeah, screw it. I'm just going to call him. And what's he going to say? No. And then I move on to something else.
Exactly. What's the worst that can happen?
If you don't ask, you don't.
It's definitely
you don't know. And I think David and I are cut a lot from the same cloth. We want to have incredible patient care. We love our community. We want to build things that make our community better.
Yeah.
I think from a CEO perspective, I think he's been a wonderful CEO of Mon Health. I think it's grown. It's a great place to be. And so when I called him, I was like, David, I got an idea. And I kind of proposed this to him. And within like 10 minutes, he's like, I love it. Let's do it.
Wow.
And of course, if you know David, there's a lot of negotiation between. But we presented to the finance committee, and they decided to make a small investment in what we were doing. And they were really excited about it. I think they saw the same thing.
Yeah.
And kind of like the Bumblebee thing, I came upon Startup Studios. I didn't even know what it was because we're not an accelerator. We're not an incubator. Like accelerators accelerate companies that already have stuff.
Yes.
Incubators don't really help you. They're just, it's space.
Yes.
And so we're technically venture builders. We take an idea, we put a little bit of money in the idea at the idea phase.
Okay.
We've not started a company yet. We build things, we break things, we reach out to our physician network, we ask questions, we do patent analysis to see what's on the landscape.
Yeah.
We look at the market analysis, and we start to say, it's very interesting because now when you see a lot of ideas in InterMed, they're literally living organisms. They go up, they go down from a perspective of what's hot and what's not.
Wow.
We'll reach out to industry contacts, and an idea that may be very low on the attention will all of a sudden get picked up and get very hot, and it'll be like a rocket ship. And then we got to go back to the other ideas to bring them up. But but by doing this, we're able to spend some money to build things, break things, do designs, FEA analysis, all the analysis that goes into an idea. And then we reach a point of go no go. Where are we going to start a little company, or are we not? And what's happened is once you build and break things, you find it's not really a good idea. It's not as good as we thought it was going to be.
Yeah.
The market isn't as good as we thought it was going to be. There's no interest from strategics. And that becomes evident within the first 6 months. It's either going to go or it's not going to go. And so I think that's what we've been very successful in building. I think we've been very successful at Mon Health, and things in the next month or couple months will be very exciting.
How many goes have you had so far? I know this is still pretty early.
We've had a number of goes. So we've had a first exit already.
Wow.
20 months from when the doctor brought it in. I think the other thing that we're really good at is taking an idea. Sometimes when ideas come in, they're very rudimentary, and they need a lot of work, or they need the things that make ideas sexy and successful, and the oomph behind them.
Yeah.
I think what I'm starting to realize is that we're attracted to good problems. So these doctors will bring an idea to solve a problem. The idea in general may not be that good because they're very rudimentary.
Yeah.
But the problem may be very good.
There's
problem.
There's opportunity there.
And so we start to think, and we're like, okay, that idea may not exactly work from an engineering or a cost of goods perspective, or et cetera. And how can we create an idea that really leverages health tech or AI or machine learning or advanced manufacturing? And we're very good at pivoting
Yeah.
to make what may be an immature idea fit something that's a great place to be, that's a big market, that really helps patients. It's very funny. I mentioned earlier I've got 12,000 patients. It's amazing. I tell young people this, like, how am I going to make it? I can't afford an advertising budget, and I know you guys are marketeers and all that. And I tell them it's amazing when you speak honestly with people and you really care about them and you really care about the outcome and you try your hardest. It's amazing. People just come.
Yes.
And your business grows.
Yes.
So when you do a good job and you try to take care of people, things
focus
happen.
on the right things.
If you focus on the right things. And I think that's what we're trying to do with InterMed Labs is you focus on the right problems and you build something that really helps patients.
Yes.
And we talk internally about, we have a proprietary system in the way we rank ideas, and it's to eliminate favoritism of like, oh, this is my idea, we should be working on this. You can't have that in a real business.
No.
It has to be what's the best idea. And so when we have ideas that kind of compete with one another, our internal mantra is, what idea is going to help the most amount of people in the most profound way? And so when that's the type of ideas that we're growing into.
Yeah.
We're in the crawl phase. Crawl, walk, run. We're still crawling.
Yeah.
But so we had our first exit, last month. So 20 months. The surgeon brought in. It literally was a little cutout that he cut out and glued together with his son's glue and had little like crayon marks on it. We framed it. It's in our office.
I love that.
And when we looked at it, it really wasn't a great idea, but the problem was really good. And just in a few weeks, we could see both a physical and a technological way to solve that problem. We built it out. The other thing that makes InterMed Labs very unique is we're all about studying the devices. So, for example, if we have a device that we are using in people under an IRB institutional review board. We take all that data and we publish it nationally. We present at national meetings. And again, what do we get at those national meetings? You get criticism. That won't work. That wouldn't work in my practice. Okay, why?
Yeah, tell us.
Because essentially we're listening to our customers.
Yeah.
And we're also building value. That's where you meet the strategics. They're at the meetings.
Absolutely.
And they're like, maybe our
work.
company.
Yeah.
And so I think publishing is really big. So we get this to a certain point. We get IB approved. We start using it on patients. All of a sudden, the reps that are in there, they're like, this could be very interesting.
Yeah.
Next thing you know, publicly traded companies are sending teams to Morgantown on private planes and all sorts of stuff to evaluate. And then, we had an exit, which was very good. I think that there are a number of products that could do that.
Yeah.
It's just, it's going to be. We want to take. So the way I look at this is, you want to build as much value as you can in a device or product, and de-risk it as much as you can before external money comes in. Because once external money comes in, the whole game changes. The levels change.
The amount of control
changes, dilution changes, and you want to build. You want to get as far down the road as you can prior to outside money.
Yeah,
that's what we're really, really good at. And so when you start adding all of these things together, like releasing the bottleneck of physicians, the backup, having a wonderful team of engineers and business people and tech people that can really build things, those people are very good at, I'll call it pivoting, but I would say out engineering.
Yes.
Adding the tools and bells and whistles that you're going to need to be successful at the next level, being integrated with some venture capital or angel networks, so that you have good money very early. So once you get past 50 grand, then you go to angels and then raise to get as far down the road as you can, bootstrapping. I think
which
that's
increases the likelihood of success overall.
Well, and you're going to figure out in that first 50 grand whether you're going to fail or not.
Yes.
Every time we go along, we keep evaluating. We always look internally. What's wrong with this idea? Why is it bad? How could it be more successful? Instead of just drinking the Kool-Aid, we're constantly trying to pour the Kool-Aid out.
Self-critical.
Yes.
Yeah.
And if you're self-critical, if you're honestly objective about the idea, you come up with some really wonderful things.
Yeah.
And the thing that's exciting for me is that in flyover country, these physicians and nurses and techs that are not they're not serviced. I personally view. Let me ask you this. I ask this question all the time. What do you think the best natural resource in West Virginia is outside of energy?
People.
Our people.
Yes.
Very ingenuitive, very hardworking.
I was going to say no stranger to hard work.
Willing to help out.
Yes.
I make a call to someone and they're like,
yes.
absolutely, I will help you. They don't go, what's in it for me? They go, how can I help you?
Yes.
So that was in my white paper. I think from the very beginning, I view the greatest resource in West Virginia as our people, specifically our physicians and nurses and techs, the people that are highly trained in healthcare.
Yes.
Let me tell you, the stuff that they're doing at WVU and Mon Health are the exact same
world
stuff.
Class.
The exact same stuff they're doing at Harvard.
Yes.
Okay.
Yes.
So, or Mass General or Brigham and Women's Hospital. So, they're trained in the same way, doing the same things, experiencing the same problems. Okay. But when you strip out some of the ego that may be at some of these places, and you get people that just want to solve problems, I'm telling you, that's where the magic happens. And when you feather in some very bright, young, motivated people from WVU and Marshall, we have people now from Marshall.
Yeah.
The magic can really happen. And so I'm sure that this ride will have many ups and downs. I mean, right now we're on and up, but it's been really exciting.
Now, are you still contributing your own ideas, or are you more so managing the other ideas that are coming in?
It's both. It's we've never really publicized to people that we're taking ideas. Other than like we haven't gone to grand rounds and talked it up. They just literally just find us.
Well, I bet.
So we're now starting to take in many more ideas.
Okay.
That's a whole problem in of itself, is how do you control the flow?
Yes.
How do you quickly identify them?
Because this is a small team. I mean, I love how you've set this up. It's like a little special operations team of experts just, coming around this person to support them. Because I think too about how many ideas just stay in someone's head their whole life, because going from idea to execution, there's a long process.
People don't realize that they call that the valley of death.
Yeah.
People don't realize how hard it is to get across the valley of death. And again, many of these people don't understand failure. They've been the brightest in their class. They're the best physician around, or what have you, or best nurse around. They don't understand failure, and so I think it's important to have that team around it. We all know this is a proven fact. Innovation occurs in small teams, period. And I think that big corporations, they realize that, and they're starting to outsource to smaller teams.
Yes.
They're looking for solutions. They're looking for those people that can pivot. And so I think it's kind of we're nearing a perfect storm for InterMed Labs of solving those problems, because we're not a design firm. Like I can I can take my idea for this bottle of water. I can go to a design firm and I go, okay, I want you to design this. Yeah. And you're going to get that.
Sure.
It'll be beautiful. And here's all the drawings and all that. But they're not going to be the ones like, well, this water looks exactly like this water. Right. And how do we make this cap is smaller than that cap, and all of the engineering that needs to go into what makes it a more valuable product for the end consumer, which is a corporation, or the end user, which is a patient. Yeah. How do we help that? How do we put the research behind it, the money? How do we traverse that valley of death? Yeah.
And that's huge. But I mean, that's what you've built, is supporting that.
Yes.
Wow. So I'm curious though, because when you told the story, your initial story of the idea that you had, that you were flying out to San Francisco and that one ended up failing, what kept you motivated? And because I think about so many people that were just thrown in the towel much earlier on, what was it that caused you to keep going with that?
I don't know. That's a good question. I don't know. Maybe it was just I wanted I just wanted to work until the very end.
Yeah.
I think that, when you see a good idea, you really want to put your entire effort into it. I always had hope that it would work. People really liked the idea, although it had poor adoption. But the device worked really well. And I think
So
I always
you believed in it.
I had hope.
Yeah.
And I believed in it. And I think if I were to go back and, 10 or 12 years ago, I probably would have gotten off the idea a little bit earlier when I saw some resistance at key points. Having, hindsight's always 20/20, but
Sure.
Having those resistant points, like I don't have an MBA. I consider that my MBA, like the trials and tribulations of going through that.
Yes.
But I think I was just really determined. I think to go back to our best asset, which is people, I feel like most of the West Virginians I interact with are very determined. And it was probably just pure drive. I wanted to prove people that we could do it from West Virginia. And I still do.
Yeah.
I tell people all the time, and it was in my Rutgers Grand Rounds 2 days ago. I was like, I'm a old, fat, bald man from West Virginia. I don't need to be doing this. I don't need to be having Grand Rounds and inspiring kids and all that. I don't need to do that.
Yeah.
I don't even need to do InterMed Labs or anything. But even at this age, I want to inspire. I'm determined to win on InterMed Labs and all these ideas that are coming in. I just still want to win.
Yeah.
And I think, maybe it comes from tennis and other sports. I don't know. But if you're going to play the game, you have to play to win.
Play to win. Yeah, absolutely.
So maybe that's it. I don't know.
Yeah. No, it's just interesting to me because I feel like you have been able to sustain that momentum far longer than most people do. Because I think is typically, and there is a ton of failure with innovation, but I think typically people, they put their heart so much into an idea, and then the first bit of criticism they get, it goes in the drawer and it never comes out.
It's because it hurts.
Yeah.
I think your ideas are like your children. I mean, you wouldn't want somebody to say, oh, your child is ugly or your child is not smart.
Right.
And that's when you show people your idea, you're showing a part of yourself that maybe you just talked to your wife about or your husband or a close friend who's not going to be as critical. Yes. And then you show it and people go, oh, that's the dumbest idea I've ever seen. And you're like, oh my gosh. And you go back into your shell and then it's hard to come out. I think that's probably a to get that is, it can be taught.
Yes.
I learned it just, you would show things and people would say, Tom, you're stupid, and you move on. Yeah.
Well, I mean, the more times you fail, the more comfortable. If you can practice at failing and put more bad ideas out there quicker and you get more comfortable with, okay.
I think
it's part of the process.
I think there should be some bookends or some bumpers on that. I mean,
for sure.
You don't want to
spend a lot of time putting out bad ideas.
Yeah. I think that so the way in which I teach my students is constant iterative thought with yourself. So one of the best ideas, I got COVID a few years ago and had one of my best ideas, which I can't say it should be coming out soon, but pre-InterMed Labs. But I was in a room, I couldn't go anywhere, and I could consistently think about ideas. And so I think you should write out the idea, you should draw the idea, and I think you should think about it for a month before you tell anybody.
Yeah, that's
so that
good
you
advice.
Constantly iterate. And during that time, you can be researching, Google patents and seeing what's on the market and seeing what other people are using. And then when you're like, I think, I can't figure out a reason why I don't like this idea.
Yeah.
I think that's when you kind of tell your friends and family and go, what do you think about this? I like to use my friends, like, for example, in plastic surgery, hand surgery. I'll reach out and again, if people out there listening have an idea, I would get an NDA and there's a whole lot of rules around things.
For sure.
But for close friends, I'll reach out and go, hey, do you guys have this problem? Like, what do you do? What do you do when you have this problem? Constantly.
Yeah.
And I don't tell them my idea. I'm just like, are you seeing the same thing?
Is this a problem? Yeah.
Are you seeing the same thing that I am? And they're like, oh yeah, it's, I've tried this and this and this. They all stink. And, I kind of wish we had that. I'm like, that's very interesting. And then I'll go back and think and I'll do some more. I'll file a provisional patent if I like it. And then I'll tell people. And so at that point in time, if they're like, no, that idea is stupid, well, then, I put it in the drawer, but I never forget about it. And I'm like, well, if I pivoted to this, that you need constant thought and constant iteration on those ideas. And most of them won't go anywhere, and most of them should stay in the drawer.
Yeah.
But, they're like plants. I started a garden this year.
Oh.
I'm a terrible gardener.
I am too. That's why I was like, oh,
well,
how's that going?
I was talking to my mom on the way over here, and I'm like, I was like, when do you put out the tomato plants? Like, and they're, I've got like netting over, and she's like, they're going to grow like 4 feet tall. And I'm like, oh my God, my netting's only like 2.5. These are the problems I'm solving now.
I call my mom the same thing. Yeah. Can I plant bulbs now? Yeah. Are we done with the frost?
I don't think you ever stop calling your mom, but yeah. I think, ideas are like plants. You sometimes they need dark, and sometimes you need to water them, and sometimes you just need to leave them alone and let nature take its course.
Yeah.
I don't know the exact right answer, but I continually think about the ideas. I reach out to very close friends. I find out what their problems are. How would my idea apply, alter? When I get to a point where I can file a provisional, I'll drop a provisional, which is not that expensive.
Yeah.
And then share it.
And you share.
And then if they shoot it down, it's not the end of the world. It's funny. As I get older, I call it meme-itis. My grandmother, she would say things when I was a kid, and I'd be like, oh my God, very direct. Like, I don't have time for this. Like,
no filter.
Like, this office is just terrible.
Yeah.
And I'd be like, oh my God, Mimi, you cannot say that. Like, embarrassed.
We have the same
like an embarrassed teenager.
Yeah.
And when I look back on her, I think what a wonderful freedom that was. And
yes.
And so I think I've developed more like that to where I'm just gonna say my idea, and if they don't like it, it's okay.
I'm
just going to move on. And I think that sort of liberty maybe doesn't happen until you get a little bit older. And maybe that's why young people are a little bit more stifled.
Yes.
But most innovators that are really, really successful just don't care.
Yeah. Yeah. Right? They're real comfortable in their own skin.
Yes. And I think when you get comfortable in your own skin, then you can share ideas more freely.
Yes.
And when you get that criticism back, it's not personal.
Yes.
It's just, okay, I'll move on.
The idea. Well, and I think, when you talk about the iteration process, I think that's a key point, because if you're stuck on a certain idea only staying a certain way,
yes,
that can be crippling in terms of your success with that. If you're not willing to flex, if you're not willing to adjust or reframe or do any sort of modification.
To piggyback on that very comment, okay, adjusting and changing and be willing to do that, you must be willing to share. Okay, so one of the problems that I found with physicians and literally other people as well is that they get like the Gollum syndrome.
Yes.
My precious, this is my ticket to fame and fortune. No, it's not. There's a lot of work to do.
Yeah.
And you will. So that's my last trait of the ideal entrepreneur that I give in my talk is I tell them to be George Washington, to step out of the way. You're not a serial VC. Serial CEO. You're not. You don't have the skills necessary to take this. You need people to help you that share a similar vision and will be additive to your product, that will help your plant or child grow.
Yes.
And that innovation is a team sport. And if you're not willing to share with your team, I'm very lucky. I have just such wonderful partners.
Yeah. Wonderful partners.
I thank God every day for the partners that I have, because I've been in situations where it's not great.
Yes.
But that you need those people to make your baby a reality.
Yeah.
And that you have to share. You got to share the equity and the money and the success and the fame and whatever else is going to come with your idea, and the failure.
Yes.
And if you really know you have good partners when you fall flat on your face, the idea is terrible, and they go, okay, Tom, what's next?
Yeah.
What are we going to do? And I'm like, God, I love you guys.
Yeah.
So I think sharing is a
huge
big part of innovation, and I think not sharing from a leadership perspective, to go back to your leadership talk, but to hear all those voices and create a direction
Yes.
that's beneficial for the whole team is part of leadership. It can't be like, we're going in this direction and F you guys, and
Yes.
this is what we're going to do.
This is where I'm the boss and I say so.
Yeah. I mean, I don't want to be that person. I think those are not good leaders. I think a good leader is strong and leads by example and listens to people and then makes an educated decision. And when those people don't agree with it, they pull them aside and go, this is why we're making this decision and why we have to share. And it's for, this greater purpose.
Yes.
To improve our state, our economy, our younger people. And then I think the other thing is having a big vision. Okay. When I tell young people, I want you to change the world, like they're like, oh, okay. Yeah, that's so great. Yeah. And I'm like, no, I'm effing serious.
Really? Yeah.
You are young, you're smart, you're vivacious. Go, if you don't think big, you're not going to get halfway there, which is going to be amazing. Right.
Yeah.
And so I think having an overarching vision of, I hate to say this out loud, like when I say I want to make things better for West Virginia, I want to hire young people, that's not like me saying that. Like, I'm going to do that.
Yes.
And it comes from the subconscious and it moves into the conscious mind.
Absolutely.
And then it happens.
Yes.
And you're like, oh my God, we've got 5 engineers.
I put it out there and then it happens.
So I'll call the WVU Business School, Josh Hall, who's a wonderful person. His kids are wonderful tennis players, wonderful family. And I called him and I'm like, he's dean now. And I called him and I'm like, Josh, I think MBA students would be great over here.
I was thinking that too.
Yeah.
While
and he's
you were
like,
talking.
Tom, I like that. Let's, okay, fine. And we work with Joe Duda, who's our executive in residence. And Joe got 5 MBA students over, and we were doing market research. They were presenting ideas. Last October, I went up and won Innovation of the Year at our national meeting for plastic surgery.
Awesome.
And when I say I mean our whole team.
Yes.
I was just the person there on the stage. But, the MBA students really got to see what it was like pitching, because it was just like a VC pitch, essentially. And it was really a great experience. I hope it was for them as well. But how do you inspire young kids to do innovation when they're not there? Right now, we have a high school student whose father works at NASA in the lab.
Amazing.
We've got like 5 engineers. It's really funny. These kids are so cute. I call them kids, and all my partners call them, like young professionals and engineers. And I was like, they're just like little kids to me. Yeah. But it's so funny. Like, their personalities are so different. We have one kid he's have you heard van kids? Like van people, like they build out a van and then and they're like digital nomads. They, it's a way for them to travel around the country, and they live in their van and they have composting toilets and all that stuff. Well, we have a lab over at Mont Health, and all of our engineers have like little swipe things. And so I get called by the head of security, and they're like, do you know there's this guy who comes in at 2 a.m. and he's living in a van behind the building
down by the river.
Yeah. And I was like, oh, you mean Matthew? Oh, he's a sweet kid. I was like, I really like him. I was like, yeah, he's a van kid. And they're like, well, he's living in a van. I was like, yeah, that's his house. And they said, well, is that, are you okay with that? I was like, yeah, he's probably going in to use a bathroom or something. Yeah. I was like, you guys should be glad he's there, because he's probably going to look out and see something that you guys aren't going to see.
Yeah.
And, like, he's gardening. And
yeah, exactly.
David Goldberg called me the next day, and he's like, the same thing. He's like, Tom, there's this kid living in a van behind Building 3000. I was like, yeah, your security called me last night. I was like, he's totally harmless. He's a really good boy who just happens to be a genius.
I'm sure.
And when you come in and he interacts with, and he's got math written out on the whiteboard to solve a problem. And I'm like, what is this? And he's like, I just did some math.
Just bored.
To solve this problem that you had that everybody's been, going over.
Oh my gosh. So he was like no affiliation to you all.
No, he worked with us. But,
okay.
But he didn't have a home. He just stayed in his van.
Yeah.
And, but just such a wonderful kid. And we have so many young engineers that honestly, people just show up.
Wow.
People call and they're like, hey, I don't know. I don't expect money. I don't know what you guys do, but I've heard about it and I just want to be involved.
Yeah. I think people love to solve problems.
Yeah. And it's wonderful to see the talent that is at WVU.
Yes.
And I say WVU because they're local, but we also have 2 medical students that are starting this summer for an internship from Marshall.
That's fantastic.
Who are also incredibly bright. But to see the young talent that exists here, to see their interest in innovation, to see them. We had one kid, Evan Johnson. His dad is a surgeon at Mon, and Evan's just like, hey, can I come down and hang out with you guys? And we're like, yeah, we don't have any money to pay you. Here's the project that we're going to work on.
Yeah.
That kid sat at a desk for 5 months.
Oh my gosh.
And worked through various things and set stuff up.
Unpaid.
Not once did he ask for money. Not once. And I kept telling him, I'm like, Evan, I'm so sorry. I will, as soon as we get some money for your position, we'll throw you a little bit of cash because we weren't ready to hire him yet. And he's like, yeah, whatever works. I'm like, are you having a good time? He's like, yeah. I'm like, are you learning? He's like, yes. And so
that's amazing.
we just received a $100,000 Benham grant, and a large portion of that money is going to go to hire Evan to run our study in West Virginia for Fingy.
Very cool.
But isn't that incredible? You're not going to get that everywhere else.
No,
that's what I'm saying. The people of West Virginia are just,
yes,
they're really
and it's
amazing.
right literally in the backyard of your lab, which is amazing and beyond. But I mean, starting in the backyard.
Yeah. I can't say enough positive things about our young talent, and just a small part.
It's exciting. Yeah. Now, as I think about the work that you've done in private practice and then as well with InterMed and even coaching, I mean, you're in a lot of leadership roles, but we were talking earlier about, I'm sure that's not part of your standard training and as you go through medical school, nor business training, right? And I just would love to hear what you've learned about leading all these different types of people, whether it be in private practice or as an entrepreneur.
I don't know. I don't know why I'm on a leadership podcast. I want to create an environment that I want to be in.
Yeah.
So that's one. I would like to lead by example. I'm not perfect, and I'm the first to admit that.
That's huge, though.
For example, tennis. I think tennis is a wonderful story. Justin and Carrie Byers that own the tennis center are just wonderful people. I was out at the tennis center. This was before my son started in high school. And a young man came by. His name was Drew Hawthorne. He was the number one tennis player on UHS's team. And I was sitting there watching my son in getting a lesson.
Yeah. This
was maybe 8 years ago. And he was lamenting that his coach wasn't coming back and they didn't have a coach. And that they didn't know what they were going to do. They were very upset about it. And instead of going, oh yeah, Drew, I'm so sorry to hear that, and going on with my day, I tilted my head and I go, I mean, how hard could it be? I mean, it's just high school tennis, right? I mean, you organize a schedule, and I watch so much tennis. I think I know a little bit about it.
Yeah.
And I was like, well, screw it, I'll just do it. And that first year, I wasn't prepared for the amount of time it was going to take. I think I lost $70,000. And at the end of the year, when we're drawing our financials, I'm like, what in the hell happened?
Money go.
and my manager said, well, you weren't here for 3 months.
You weren't doing surgeries. You were coaching.
So we've adjusted scheduling after that. But the thing that I found, so what it was to me selfishly was it wasn't business. And it wasn't medicine. There were no lives at stake, but it allowed me to create, when I went in, I was like, I want to work hard.
Yeah.
Okay. I want you guys to work hard, but I also want to create a fun experience because that's the environment I would want to be in.
Yeah.
And I did this selfishly because my kids they were tennis players. They were going to traverse that program.
Yeah.
And so what kind of program did you want them to traverse?
Sure.
You wanted a program that was competitive and fun and focused on the right things. And that's just the environment I wanted to create.
Yeah.
And I think that it taught me a lot about kids.
Yes.
Because you see these young people that have it all put together. They're very good looking, or they're popular, or they are get great grades. And you're like, boy, that kid, they've got it going on.
Sure.
And then they come up to the fence at you at a match and they're literally in tears. And they're like, I don't know what to do. And you see that they're just little kids.
Yeah.
And to be a part of that and to help instill confidence and to say, you got to get back out there. You just You just lost that game. Here's how you could adjust a little bit and you need to get back out there is the exact same thing as innovation.
Yes.
Okay?
Yes.
When you get your butt kicked, what are you going to, okay, you're going to lay down, you lost. And I am not perfect.
Right.
We were not able to go to regionals this year, and literally I cried.
Hey, I mean, it's a big deal.
I came
now.
home and my son lost a big match, and I literally I you always want what's perfect for your son.
Yes.
I think that adversity is really important, and you don't want to see your kid go through adversity. But I wanted so much for my team to go that I was so
such a loss. It's grief.
I felt so bad for them. Like I'm like, oh my gosh, we had so much opportunity. But in the same tact, okay, I have to go across and shake the hand of everybody else and show our team that that's what you do.
Yeah.
And I certainly am not perfect. I have a lot of flaws, but I think it's a microcosm. I think sports, that's one of the reasons why I love sports, is a microcosm of life. And that, you win, you lose and all that stuff, but you help your fellow teammates. You figure out ways in which you can win. You dedicate hard work to a certain goal, a very large goal. And then you take a bunch of little steps to get there. So that's why I love sports. And I think tennis has been the most wonderful thing for me, mainly because of my children. I've got to spend an amazing amount of time with my sons.
Oh, for sure.
I've gotten to know their friends.
In a really unique way through the sport.
Funniest story, though. One of my students, I just had a student follow me a couple of days ago. Kyle Hawthorne, Drew's younger brother, wants to go into medicine now. But I'll have kids from my tennis team come chat to me because they're all real smart kids and maybe they want to go into medicine or something. Yeah. And so I'll be in a patient room with them and I had a couple of them say, I was like, do you have any questions? And they go, well, Coach Tom, what do you think about this? And it's not doctor, it's not, it's Coach Tom. Coach, and I look at the patient and the patient's like, what is going what is going on
you
here?
Have no idea.
Yeah. And I think that that's probably the title I'm most proud of, honestly. Aww. Yeah, it's been really fun for me, and been great for my kids. But.
Yeah, that's amazing. Yeah. I love the lessons from that. When you said shaking hands, I had a flashback to middle school, which was the first time I went through any sort of like official tennis camp. And I remember I'd played a little bit prior to that, but just, my dad taught me and my brother and my sister how to play. So just kind of knocking around the court. And I was in an official camp and they had brought a girl who I was probably 6th grade. She was 8th grade. She absolutely smoked me. Yeah. It was crushing. Yeah. But so I'm like, let's go to walk away. And she's like, come here. She's standing at the net. Yeah. And I'm like, what? And she's like, come here, shake my hand. Yeah. And I was like, what is she talking about? So I did like a dead fish and she's like, that's not how you shake a hand. And that's how I learned not only how the proper way to shake a hand, but so much more about life and that experience was like, you get up here, you shake my hand like a winner, even though you lost, you shake like a winner and you walk away and you regroup. And I mean, it was a tremendous life lesson at a pretty young age. I mean, I was probably in 6th grade when that happened to me, that you carry with you, and not just in tennis, I mean, all sports, but I think it does create really good life lessons.
I completely agree with you. You can ask all my kids, if you saw them on the street and asked them, I was like, what do I ask you to do? There's only 2 things that I ask of you. Have I ever asked you to win? Like you need to go out there and you must win. No, it's effort and attitude. Yeah. And I think that's the exact thing that makes you, different definitions of success, but at least in innovation and medicine, your effort and your attitude, your rapport with people, being able to talk to people, being able to read and connect develop the dots and then connect dots, energy, work ethic, when stuff's not going your way, try to have a positive attitude. If not, just stay quiet.
Right.
They're all good life lessons.
Yeah, but those are two things you can control.
That's all you can control. That's
Yeah.
it. That's the only thing you control.
Yeah.
Well, they'll come up and they'll be like, the wind is so bad. I can't, my spacing's off. And, the sun is in my eyes. And I'm like, the wind's a problem for them too.
Yeah.
And the sun's in their eyes too. So you need to have an honest discussion with yourself of what is the real problem.
Yeah.
Stop being scared.
Yeah.
Go out there and I don't know. It's I think tennis has just been really, really wonderful.
Yeah. I played doubles and which is great when you're having a bad day, because sometimes when you have someone else there, if they're having a good day, then that can offset. But when you're both having a bad day, it's very bad. And I'll never forget, my partner and I were playing twin sisters, and we were both off that day, and we were really struggling. We were really down. And then all of a sudden we just decided to start celebrating even the most minimally acceptable shot, something that was nothing exciting. We'd be like, yes, and high-fiving each other. We started messing with their heads so much that we ended up winning the match. Well, they were so thrown off by our attitudes and how excited we were that they were just like, what am I missing? And totally messed with their heads.
and again, I think the positive attitude, even for the little things, it starts this little ball of momentum which carries.
Yeah, that energy.
Yeah, the energy. It's just look, you want to go through life like that. With a positive energy, with a goal of helping people, with a goal of creating things, and again, trying to give back to your community in a way in which you can.
Yeah.
And I think that to me is a good leader.
Yeah, I think so too. Yeah, I'd like to close by just thinking about what your perspective is on opportunities that you see out there. Opportunities for people to solve problems or step into leadership, but what do you see on the horizon as ways that people can get more involved, ways they can put their talent to use and really have an impact and change the world?
First of all, I think this is the most incredible time to be alive ever. The ability to have access to AI is going to be incredible. The micro manufacturing is simply incredible. What you're able to do from an engineering perspective, from a programming perspective. Have you been on ChatGPT yet?
Yeah, a little bit.
The amount I'm a computer guy. I like to build websites and things like that. And you have to write back-end content and marketing and things like that. The ability to AI to do that is fascinating. It's very high quality. And I think marketing will have a big problem if people start, I probably shouldn't say that on this podcast, but
no, it's okay because
it's coming.
Jim Matuga, you have to talk to Jim Matuga, who's the owner of Interaction Media. He has a product called Storymaker that is a SaaS product.
There you go.
Yeah. So there's solutions. The smart ones are creating solutions.
So I think it's a very wonderful time to be alive. There's lots of problems in the world, but I think that from an innovation standpoint, the best way in my mind is just to put yourself out there, to ask questions, to not be afraid to cold call people. Here's the thing that's amazing is that people really want to help.
Yes.
Like my tissue expander wouldn't have gotten built if I didn't reach out to somebody and say, hey, what do you think about this?
Yeah.
InterMed Labs wouldn't have happened if David Goldberg would have said, no, I'm not interested. I'm playing golf with my kids or whatever.
Right.
Don't bother me.
Don't bother me.
Right.
It's a Saturday.
But unless you ask, you never know. So I gave grand rounds to Rutgers on Wednesday, as I mentioned. I've already had a medical student from George Washington reach out to me and say, I have an idea I want to discuss with you guys, and we want you to speak at our innovation conference at GW.
That's awesome.
That person, I can tell you right now, I don't remember her name. She's going to be successful. Because that's what successful people do is they reach out, they put themselves out there.
Yes.
And so how do young people go down, learn some skills around what your future wants to be?
Yeah.
AI, ChatGPT, medicine, whatever it is. what is the end goal to get there? Okay. Like, okay, here's where I want to be. What is the path to get there? Like, put some thought behind it.
Yeah.
I remember when I wanted to do plastic surgery and I was a medical student, it's very difficult to get into. And I remember where I was. I remember where my desk was. I remember what apartment I was in. Like, I remember it exactly. And I forget a lot of stuff. But I remember going, this is going to be my path to get to all the little zigzags, the 1,000-mile journey to get to this end goal. I still remember making that list. Wow. Here's where I want to be, and here's my convoluted path to get there. And then you reach out to people and go, I want to do this. Can I come shadow you? Can I do this? It's putting yourself out there at every step.
Yes.
Doors are going to be shut. People will say no, blah, blah, blah. You just keep moving.
Just keep going. Like
the little fish.
Yeah.
Dora. And I think that's the best thing. And knowing that this is the best time to be alive. And I think that if you're a go-getter, this is actually a great time to be a go-getter.
Yes.
Because I don't think you have to outperform that many people.
No.
So
not as many of the go-getters around lately.
Yeah. And I think if you just outperform 15% of the people, you're gonna be really, really successful.
Yes.
So I think it's like a perfect storm.
I think so too.
And ignore the negative sayers. Put yourself out there. Yeah. Pick a big goal, way out in front of you. Find the path and start making phone calls and work very hard.
Yes. Well, yeah, that's an important ingredient as well. Yeah, you got to have that. Yeah. Amazing. Thank you so much.
Yeah, you're very welcome.
Anything else that we haven't talked about that is important to you to share today?
Nothing I can think of now.
Okay, this has been amazing.
Yeah, thank you so much.
I'm just excited just to hear. I appreciate you going into so much detail about InterMed and your story. And I don't feel like you see or hear a lot of examples of people like you doing the work that you're doing. And again, just it's outside of the normal standard career path that you see a lot of times for a physician. And so it's exciting to see what's possible.
I hope that's a problem that we solve.
Yeah.
So that, when you have a talk in the future with someone that there are 50 innovators that come out of Morgantown.
Yeah.
The resources are here. The people are here. And I hope that problem gets solved so that it's not so unique.
Yeah, absolutely. Thank you.
You're welcome.
All right, lightning round.
Okay.
We can do the lightning round. 60 seconds to answer as many open-ended questions about yourself. And your timer begins now. What season best fits your personality?
Oh, spring.
Okay.
Yeah.
What's your most used emoji in text?
Probably like crying, laughy face.
Yeah. What book, song, movie, or podcast has had the greatest impact on your life?
I'm a big believer in, you asked me too quickly. I don't like lightning rounds. Well, certainly Art of the Start by Guy Kawasaki. I've read probably 100 times. I've outlined, etc. I'm a big believer in outliers. I make my medical students read Outliers.
Malcolm Gladwell.
Gladwell. Yep. And the thing that I take from it is there's lots of smart people in the world. It's what you do with it.
Yeah.
I don't think so. This is what I tell my sons, and I would tell the young people out there. If you're a genius, you can't be successful. If you're the hardest working person in the world, you can't be successful. You need a certain amount of intelligence and you need a certain amount of work ethic.
Yeah.
If you're
keep going.
if you're a reasonably smart person and you're a very hard worker, amazing opportunities can come. It's like the diagram. The harder I work, the luckier I get.
Yeah.
That's not hard work isn't everything, but you have to have some intelligence and then you have to apply it. And so I love Outliers. That's been a big fan of book of mine.
Amazing. All right, very good.
That's
Thank
it.
You. That's
Two questions. Oh my gosh.
It's a lightning round. It goes quick.
Lord have mercy.
I'm going to close it out here. That's all the time we have for today's episode. Until next time, shine bright, everyone.